Parents are constantly hovering around the child like a helicopter, constantly to ensure that nothing bad happens to them. Here it differs from normal and healthy parental involvement and control. If you see in a playground, so many of the parents might be in a panic mode, found that they have poor workplace adaptation, lower quality of life. The child tends to have lack of autonomy, self-efficacy. They have ineffective coping skills. I'll be talking in brief about the mental health implications of overprotective parenting. When we use the term overprotective parenting, we have many synonymous terms like helicopter parenting or hyper parenting. So when we use the term helicopter parenting, as shown in this image, so if you can see, the parents are constantly hovering around the child like a helicopter, constantly to ensure that nothing bad happens to them. So overprotective parenting refers to exerting excessive control over the child, excessive regulation of the child's actions, even exerting psychological control over the child, such as instructing the child about how to think, how to feel, also curtailing the child's independence, self-reliance. Another characteristic is prolonging infantile care. That is how you would take care of an infant, how you will take care of a small baby, irrespective of the development of the child. The parent continues to treat the child like a baby, excessive involvement, interfering in the child's problems even when not necessary. So many of us might think that children need some amount of control and involvement from the side of the parents. However, here it differs from normal and healthy parental involvement and control. I'll give you certain examples of overparenting or overprotective parenting. One example would be the parent taking over the child's schoolwork. If the child has some issues at school, for example, the child's grades have fallen, instead of encouraging the child to go and speak to the teacher, the parent itself picks up the phone and speaks to the teacher and tries to solve the problems on behalf of the child. That would be one example. If you see in a playground, so many of the parents might be in a panic mode, asking the children not to go there, not to run, not to jump, not to touch anything that is dirty, constantly informing them about the dangers, that you will fall if you run, constantly being on a panic mode and ready to catch them if they fall. Doing all the chores for the patient, cooking, laundry, money management, that would be another example. Making all important decisions in their life, that is who to make friends with, what to do in their free time, what would they eat, what hobbies or sports would they pursue. So in short, making all decisions for the child. So it is actually a much greater involvement and intervention in the child's life than what is normally regarded as the limit up to which the parents should care about. So the whole point of overprotective, the principle is that the child should not get injured, child should never feel upset or defeated. That is what most parents aim to achieve through overparenting. I'll just give an excerpt. Johanne was never allowed to go with the rest of us to the sea to swim. Her mother was far too scared that anything would happen. Then the terrible thing occurred during the war when the ferry was bombed and sunk not far from the shore. Johanne and a friend were in the ferry. The friend could swim, so she managed. But poor Johanne had never learned to swim, so she drowned. So this is an excerpt from an author named Boyanson. So here this shows that parents are constantly in a dilemma when they have to decide what risk they want to let their children take. Children are the most valuable possessions of the parent, and parents never want anything to go wrong in the life of the parent. So in this case, the friend had learned to swim, but mother could not let Johanne learn to swim because she was quite anxious about what if she drowned. So in the end, she met with a very fatal outcome. So now, various researchers have tried to see what are the mental health implications of overprotective parenting. So there are various studies which have been conducted in children of various age groups, starting from a young and tender age of 6-year-old to college-going students. And most of the studies have consistently found that overprotective parenting can lead to adverse mental health outcomes in the child, namely increased scores on anxiety, depression, leading to lower self-esteem, helplessness in the child, And in an advanced age group, they have found that they have poor workplace adaptation, lower quality of life. The child tends to have lack of autonomy, self-efficacy. They have ineffective coping skills. And one interesting finding, even the child scored high on scores of narcissism. So let's see, what are the mechanisms? How does overprotective parenting lead to all these kinds of mental health implications? So many of the studies have shown that too much of parental control will limit the child's access to the environment around them. So if the child is placed in an unpredictable situation, the child has to assess the risk, arrive at their own decisions, learning to their internal cues. In case of overprotective parenting, they are constantly learning that they have to check with another person to, or look up to another person to guide them. So in this case, children do not acquire essential life skills that are necessary to find a solution when placed in an unpredictable situation. Also, through the act of overparenting, parents are communicating to the children directly or indirectly that they themselves, that is the child themselves, is not capable of finding a solution to their problem, that the parent knows what is best for the child and the child is not equipped or capable of dealing with it on their own. So this in turn leads to lower self-confidence, lower self-efficacy and competence. So also, when the child is kept in a protected, safe bubble, what happens is child does not have an opportunity to practice any kind of vital life skills. The child is always under the care of the parent, and child never has had the opportunity to face any kind of challenges. So all these situations will lead the child to have lower self-confidence, leading to increased levels of anxiety, increased levels of depression. So in short, what happens is, in case of overparenting, the child does not develop any kinds of coping skills, problem-solving skills, planning, or pro-social skills. That is, the need, that is that they can approach others for help. How do they wade their way around a problem? Their socialization is affected. So all these lead to increased vulnerability of the child to develop mental health problems in the face of stress. So in short, what I would like to conclude is that though protecting a child to an extent is has its own beneficial effects, however, the parents mean the best for the child. However, sheltering them from all of life's difficulties and preventing them from experiencing life as it is in the long run might have a lot of mental health implications. And many a time parents need to remember that it is okay for the child to fail sometimes. It is okay for the child to not succeed and to make mistakes. We need to inform them what is happening in the world, the situations, the dangerous situations, the things that we read in the news. We need to discuss with the child and ask their opinion. Like ma'am was previously saying, there needs to be a collaborative decision making as the children grow older. Age appropriate level of the control and restrictions have to gradually reduce from the side of the parents, so that the child is empowered to face difficult situations on their own. Yeah, thank you.